Okay, so we'll make a start there, folks. It's my pleasure to introduce Jon Olsen, who is a senior research fellow at the University of Glasgow. Previously, he did his PhD at the University of Cardiff, John, and then worked for the NHS for a while before moving up to Glasgow to work, broadly speaking, in kind of geospatial, kind of public health, sort of social epidemiology. So over to you, Jon, to take it away.
Thanks, Tony. Thanks, Tony, and it's great to be here. And as Tony said, I'm a background in geography, so I studied geography and then public health and epidemiology. So my research, I really try to bring together health geography, so understanding how place and the places we live can influence our health and health inequalities. Over the past few years, I've done a lot of work around how places can improve health and reduce inequalities. And obviously with the big push towards 20-minute neighbourhoods globally and here in Scotland, my work is sort of focused on that a little bit. So that's what I'm going to talk about today. But first, I thought I'd set a bit of context around health and health inequalities. And what we know is that life expectancy in the UK is declining. So this is data from the Global Burden of Disease study. And we can see that we had this trajectory where the healthy life expectancy of people living in the UK, males and females, was increasing. And then it stalled, and now it's decreasing. And as well as that decrease in healthy life expectancy, we're seeing that the amount of people who are living in poor health with multimorbidities is also increasing. And as well as that, the difference between those living in the most and least deprived areas of Scotland, this is data from the Scottish Government, we can see that there's a widening of health inequalities. So the gap in all-cause mortality is actually, for those living in the most affluent areas, the least deprived, is actually pretty much maintaining, although there is a slight increase. But there's a much more substantial increase for those living in the most deprived areas of Scotland, which is actually increasing health inequalities between the most and least deprived people living in our country. And we also know that health inequalities are geographically patterned. So quite often we see the subway map of Glasgow, which is quite a nice graphic, which we see it over cities in the world, and we can see different subway stops and differences in life expectancy. But this is a nice graphic as well from Edinburgh, and it shows there's about a 10-year difference in life expectancy for people who are living just 2 miles apart, 2 tram stops apart in the city. And then for females, that's 8.2 years. So we can see that healthy life expectancy improvements are now stalling and falling. Health inequalities are increasing. And actually, this differs across place. So the places we live, spend time, socialize are really important for our health. But we also know that places can actually support health and well-being. So as well as the geographical patterning, there's aspects of place that does influence health and well-being. And there's this really nice graphic from the Health Foundation, which looks at aspects of place that can support health. So that can encourage us to be more physically active. So thinking about green spaces, feel safe and secure. So maybe more walkable places, places with less cars, reduced car speeds, better access to facilities and services, and opportunities to socialize and play. And they're aspects of place that the Health Foundation have shown that are important for our health and well-being. And the now defunct Public Health England produced this really nice report of how place-based approaches can support the reducing of health inequalities. And within it, they propose this really nice framework of the aspects of the social determinants of health that influence our health and health inequalities. And you can see that a lot of these aspects of place actually influence, a lot of these influences of health inequalities are heavily influenced and related with place. So health behaviors, so if we think about smoking, diet and alcohol, well, actually that accessibility to unhealthy commodities, these clustering of environmental bads, so fast food retailers, takeaway outlets, gambling outlets cluster within the most deprived areas. And we know lots of different aspects that are shown in this graphic, opportunities for employment, natural and built environment, goods and services, as well as power and discrimination do vary between places. So we can see that place really has an important role to play in supporting the health and well-being of our population. But I quite often see this and I think, well, what are we going to do to these places? Because places are sort of what they are. But I think it's important to realize that places aren't static, they're continuously changing. And if we look at Stirling, so I've added this little pin here, and we can see how Stirling has changed over time. So this is using some data from UK buildings, which shows the actual date the building was built. So we can see that buildings that were with pre-war, and you can see that in the top corner, there's a few. And then between World War I and World War II, there was the increase. Then the post-war regeneration, we see this real development of Stirling. Then to the 60s and 70s, it's changed again. And now we see the 80s to present of what Stirling is today. So we can see that actually Stirling's changed a lot. And what we also know is Stirling will also change in the future. So the council have committed to building 3,500 new homes over the next 10 years. So where those homes are, what access to facilities and amenities they have, all those different aspects of place that affect health and health inequalities are really important to consider as places evolve, change, as they have done in the past and as they will do in the future. And urban planning has a really key role in supporting population health inequalities as these places develop, and thinking about, you know, where those homes should be and how we should change the places that we live. And there's this really nice study that came out of, it was a Nordic study. And what it did was it looked at the aspects of place. So in terms of the amount of facilities and amenities that they had within a local area, which you can see along the x-axis at the bottom, where there's an increase as we move from left to right, from 0 to 300, as areas become more urban. And then we can see the type of travel that the local residents are involved with. So we can see that as places become more urban and there's a lot more facilities and amenities in that place, that actually the amount of car trips people take significantly decreases, the amount of vehicle kilometers traveled decreases, and then this real kick up in the amount of walking and cycling, so active trips. So we can see that in terms of maybe that shift from motorized to non-motorized travel modes, which would have significant population health benefits in terms of increased physical activity, and also reduced emissions from pollution that would affect those people, that actually urban design really has a role to play. And what we did, we thought, oh, that's a really nice study. What does that look like in the UK? And we used some data from Understanding Society, and also looked at the diversity of places. So not just what's there, but how diverse they are in terms of moving beyond just, do you have one facility, but actually how does that collate? Do you have a hospital, a shop, a school? And we found there was a increased diversity of local amenities was associated with increased active trips and decreased car trips. I think what they relate to is this, actually, when we're planning and thinking about the future of our cities, towns, urban and rural places, that we want to think about how we can increase walking and cycling, reduce car dependency, and think about local living, which is one of the buzzwords of 20-minute neighbourhoods. But I think what's really important to emphasize when we think about 20-minute neighbourhoods is that this planning concept of local living, urbanicity, walkable neighbourhoods has actually been here for a long time. So we can see all the way back in 1859, there was the city block in Barcelona, which now has been replaced by the super block, which is thinking about land use diversity, equitable distribution of services, And then we have the garden city, which is close proximity to city. So all of these concepts about walkable neighborhoods, local living, and urban planning have been there for a long time. But what the current terminology and what everyone's talking about is the 20-minute neighborhood. So that's the real buzzword in Scotland and around the world, is thinking about this 20-minute neighborhood and creating 20-minute neighborhoods. And we had a good chat at lunch about the conspiracy theories about it and why they've evolved. And we produced a video which talked a bit about some of our research that I'll go through. And it's worth just looking at the comments. I should have put them in around, you know, the conspiracy theory, but we can see that actually it's just a branding of this local livability concept that's been around for a long time, that's sort of picked up traction. So when we're thinking about what is a 20-minute neighborhood and what it means, well, it means about thinking about the home location and then what's available within a 20-minute neighborhood. So that is actually termed by many authorities around the world and the Scottish government, which is thinking about an 800-meter boundary around someone's home. So a 10-minute walk to a destination and then a 10-minute return journey back. And if we think about creating 20-minute neighborhoods, well, actually, everyone has a 20-minute neighborhood. Everyone's 20-minute neighborhood might be different in size. So if you live in a highly walkable area, you'll actually have more places and a geographically larger 20-minute neighborhood because actually the places you can visit, thinking about a road network, will differ to somebody who lives in a less walkable area. So there's a lot of differences that we need to think about. And it's so places are designed so residents can meet the most of their day-to-day needs within a 20-minute walk to and from their home. And why do urban planners want to create 20-minute neighborhoods? Well, it encourages the development of places with short walking distances to public transport, public open space, educational opportunities, work opportunities, and facilities and services for local daily living. So it has proposed benefits for both planetary and population health. And where's the 20-minute neighborhood concept been implemented? Well, its current concept has been adopted internationally. And we conducted a review looking at the policies that have been conducted globally and how they've described what the impact on health will be. And these are the countries that we found in our review. So you can see that one of the key cities is the 15-minute city in Paris. And then obviously it's built up a lot of traction in Australia, North America, Europe, and including here in Scotland, where it was included in the 4th National Scottish Planning Framework. And this was the draft, which has now been implemented and adopted. And it's thinking about 20-minute neighborhoods are a method of achieving connected and compact neighborhoods designed in such a way that all people can meet the majority of their daily needs within a walking, wheel, or cycling trip of their home. And they proposed the benefit would be on health and also had the potential to reduce health inequalities. And how that will be actually implemented is we have the National Planning Framework, which was developed by Scotland and was published last year. And then this feeds into every local authority's local development plan. So Stirling will either have one live or will have to develop a new one, which will have to be adopted which will have to incorporate those aspects of 20-minute neighborhoods within their local development plan. And what's new within the National Planning Framework is also local place plans. And this is where communities are able to come together and propose their own plans for the local development plan. And the local authorities actually have to respond to that local development plan and say how they'll incorporate that. So actually you can see how what filters down from a national level comes down to a local level and will affect our local places. But we found that there was actually a big evidence gap. So we thought this is a great concept, and it'd be really nice if we could use some of the Scottish Government's data on what they conducted and looked at around what's the situation in Scotland around what is within everybody's 20-minute neighbourhood, how that varies by people living in the most and least deprived areas, and then we could maybe model and see how we think that could affect health inequalities. And I don't know whether this will be surprising to you or not, but the Scottish Government hadn't actually conducted a baseline assessment. So we went ahead and did that. And we also have a GPS study of children, and we wanted to know whether actually does living in a well-constructed 20-minute neighbourhood that has access to lots of things actually affect the amount of time that you'd spend in your local authority, in your local 20-minute neighbourhood. So if you have everything you want, do you spend more time there? And that's something else that we wanted to answer, and I'll show you some results that we found there. So I'm going to talk now about our baseline assessment of 20-minute neighbourhoods in Scotland. And there isn't actually a defined list of what should be within a 20-minute neighbourhood. So we used the place standard, which was a placemaking tool developed by the Scottish Government. And it's usually a tool to go in and speak to communities and use it as a facilitator of discussions around local place. So it's largely used as a qualitative community participation tool, and you'll go into communities and say, what do you think about feeling safe? And then everyone can create a little spider diagram, and then it facilitates future discussions in groups. But we wanted to see what aspects of the place standard we could quantitatively measure across Scotland using robust spatial data. So we picked these 10 domains, which included public transport, accessible public open space, recreation and sports facilities, financial services, eating establishments, social and cultural, healthy food retail, primary care, and also pharmacies. So the types of things that people would access day to day for their local needs. So we excluded things like dentists, because dentists, really is supposed to go every 6 months. I think everyone goes about every 2 years, maybe 3 years. So it was very much focused on day-to-day need. So we got all this data, and then we wanted to see what was within everybody's 20-minute neighbourhood. So here I've zoomed in on Elgin, but we did this for the entirety of Scotland, including the Highlands and Islands. So we've got Elgin in the centre here and Lossiemouth up on the coast. So one aspect of the 20-minute neighbourhood we looked at was access to healthy food retail. And to do that, we just included supermarkets, large and small supermarkets, as they're supposed to provide, in lots of definitions about healthy food retail, reasonably priced food rather than small convenience stores. So we picked all of the supermarkets, and then we created 20-minute neighbourhoods, 20-minute buffers, so 10-minute walking zones from there. So these 800-meter road and network buffers. Then we took all postcode locations of everybody in Scotland. So these little red dots are a postcode location, and then combined the data so we knew whether that postcode location was within a 10-minute walk of a supermarket location. And we did that for all of those domains around the place standard. So these are green space access points. And then you can see we were able to link them as well to postcodes across Scotland. And what that data allowed us to do was look at accessibility to the range of facilities and amenities for everybody who lived in Scotland. And we can see that there's huge differences in who had access to at least one of those facilities within a 10-minute walk of their residential location. So public transport, around 9 in 10 Scottish residential postcodes had access to a public transport stop. But what we did with the public transport stop was we combined that data with the timetabling data, and Transport for London classify a high quality public transport stop as having 4 transit visits or more per hour between the hours of 6 AM and 9 PM. And they say that's a high quality public transport facility because you can just turn up, you don't look at the timetable, and you've either just missed a bus or there'll be a bus coming soon. And we can see that there's a huge difference between who just has access to a public transport stop or a high quality frequent public transport stop. And then the lowest access was primary care services, so GP practices, where 40% had access to a primary care service. And this was for all urban and rural residents. So then we redid the analysis and stratified by urban people, and you can see that for the urban residents, as we'd expect, the accessibility increased significantly, and for rural residents in Scotland, it decreased. And which makes perfect sense, we'd expect it, but actually within the draft national planning framework, there was an ambition to create 20-minute neighbourhoods across Scotland for urban and rural residents. And I think this data showed that that's just not really something that's achievable. And there's a lot of great qualitative research out there that have gone in and spoken to rural residents, and the types of communities they want are very different and should be based on local needs. So that's where maybe the local place plans will be more helpful. So we can just see some of those, really substantial differences there between the urban and rural residents, especially with the high quality public transport, which really decreases significantly for people living in rural Scotland. And the next question we wanted to see was linked to the proposal of the Scottish Government that actually creating 20-minute neighbourhoods would decrease health inequalities. So we took each of those residential locations and linked it to the Scottish Index of Multiple Deprivation. And then we wanted to see whether there were differences in who had access to facilities by those most and least deprived residential locations. And what I think everybody expected was that the most affluent people would have better access. But what we found for across all of our domains was actually people living in the most deprived areas of Scotland had better access to those facilities and amenities. And when you think it through, it actually makes sense because the majority of the most deprived areas of Scotland are within urban, dense areas, which do have access to a lot of facilities and amenities based on their population need, geographical place, and those urban dense centres where the individuals are living. Which then gets the question about, you might have access to things, but are they good quality? And that's a question I think moving forwards about 20-minute neighbourhoods is, what is a good quality 20-minute neighbourhood as opposed to just a 20-minute neighbourhood with lots of things. And as I said, it's really linked with urbanicity, as we'd expect. So when we look at the density of residential areas which have access to lots of amenities, we can see it basically is just highlighting the most urban areas of Scotland. And we've zoomed in a few cities and we can see that there. So I think that painted the picture, and it's quite interesting. It was useful to present that and discuss that with the Scottish Government because they were generally quite surprised that people living in the most deprived areas actually had better access to things, and it really opened up a question, I think, for us as researchers and as geographers, and thinking about the environment, about how we'd assess the quality of these things and how we do that. And that's something that we're trying to do. Public transport was really easy because the quality is more transit visits, better quality, less transit visits, or zero poor quality. And we can think about that about green space. So maybe a more diverse, biodiverse green space is better for health, but there's still a lot of mixed evidence around how that affects population health. So that's something that we could take forwards. But what we also only looked at, and I think is only discussed around 20-minute neighbourhoods, is access to things that could improve health. So what we wanted to do in the next step of our research was thinking about things within people's 20-minute neighbourhoods that could potentially harm their health. And that's what we did next. And what we wanted to also do was think about children's mobility. So if you live in a great 20-minute neighbourhood, do you spend more time there? And we use data that we have access to at our unit, which is linked to Growing Up in Scotland. And we basically asked around 700 children to wear GPS devices back in 2015-16, and it tracked their location every 10 seconds for a week. So we knew where the person lived. We could link to demographic data, socio-demographic data from Growing Up in Scotland, and then where they travelled at 10-second intervals for that week while they had the device. So what we wanted to do was think about potentially health benefiting and health harming environments that children might have access to. So the schools, public transport, but also things that might harm their health. So living close to a busy road, a minor road, and also unhealthy food and drink outlets. And similarly to the other study, we performed a spatial join. So we took the home locations of the children, and these are actually areas of Glasgow where I've lived, rather than actually any children's data. And then we created those 20-minute neighbourhoods. So those 800 meters buffers. And what I think what's really nice is, I don't know if you can see it too well, but you can see that the actual geographical size of them does change, which I think is a really important aspect of how far you can go and thinking about walkability. So we zoom in here at this area, Queen's Park in Glasgow. We looked at geocoded the spatial features, so thinking about the number of primary schools, supermarkets, places of worship, public transit stops, unhealthy food and drinks, and also the proportion of public parks. And then for each of those 700 children, we summarized those features. So you can see here for the area I lived in, I had great access to 2 primary schools. And by being able to link to the Growing Up in Scotland cohort, we also knew whether the child attended that school. So we knew they had schools within 800 meters of their home, and then if they did actually attend their local school, which I can show you the data about. And then we were able to count the number of facilities within that local area, and also summarize the area of public park within a 20-minute neighborhood for those kids. So this allowed us to look at, does 20-minute neighborhood spatial feature vary by sex of the child and by their socioeconomic status? And what's really interesting is we see this pattern again where, for boys and girls, we found no differences. So which we wouldn't really expect at that age between what type of place they live in. But when we looked at the differences between the children living in the most and least deprived areas of Scotland, we did start to see differences. And again, we saw that children living in the most deprived areas of Scotland, they had more things within their places. So lots more things that might be good for them. So 50% did have the school within 800 meters of their home, which actually is really important because there's lots of studies that have shown that the association between the location of the school and a child walking actively or cycling to school, there is actually around an 800-meter threshold. So when you just take it and look at for a cut-off threshold effect between the parent walking them to school or cycling them or driving them. So that does seem quite important around thinking about actually attending a school within your 20-minute neighborhood within 800-meter walk is actually associated with potentially walking and cycling there. And we see that they have much more sports facilities, so 6 times sports facilities within their local area. But then when we think about factors of the environment that might damage their health, so we see this is where we see the difference. And this is where it sort of tells a much more interesting story about the differences between those 20-minute neighborhoods. So we can see that children living in the most deprived areas had over double the amount of major roads in their local space. So we're thinking about encouraging children to walk and cycle more in their local area. Is that safe for that child to walk and cycle because they've got much more busy roads? There's the pollution, there's the traffic, and the same for minor roads. And also they had over 4 times as much access to unhealthy food and drink commodities within that local area. So the access to unhealthy foods, how that will affect health behaviors, health behavior choices. We can see that the local environment does start to really may affect their behavioral choices. And we also wanted to see whether what's within a 20-minute neighbourhood affected the amount of time they spent there, and whether those individual facilities had any effect. So we also modelled that. And what we found was boys and girls, there wasn't much difference in the amount of time they spent within their local area. But we did see that children from the most deprived areas spend a lot more time within their local 20-minute neighbourhood. And a lot of researchers found this, especially there's a lot of studies that have looked at how far people go to green space. And you see that actually people from the least deprived areas travel a lot further and will maybe go to a destination green space, whereas children from the least deprived area, and this might be due to low car ownership, lots of different factors, or just actually that want to visit a different space and the opportunities. So what we're seeing is that children from the most deprived areas, they have a lot more unhealthy things within the local areas, busy roads, and actually they're spending a lot more time in those places as well. And then whether any of those facilities were actually associated with the amount of time they spent locally, the only factor that we found, which you might expect, is whether the child's school's there, because the two locations children spend most of their time are at home or at school, and actually having a school within their local area was associated with spending a lot more time there. But within the modelling, we didn't see any of the other facilities and amenities sort of predicting the amount of time that a child might spend within their local area that we could say that's good or that's bad. But the school is really important in terms of that evidence body that suggests that it might lead to a walked trip as opposed to a motorised trip. So just summing up, we see that children's residing in most deprived areas spend more time there. And there was variation in access to facilities and amenities for children in the most and least deprived areas. So children from the most deprived areas have more supermarkets, potentially accessing cheaper type of food, public transit stops, schools. But then on the other hand, they have more unhealthy food and drink retailers and major and minor roads. And then the school was a key location for spending more time in their local area. So what does this tell us? Well, in terms of the 20-minute neighborhood, I'd say we need to move away from talking about 20-minute neighborhoods, and we need to think more about creating healthy local neighborhoods that support and facilitate healthy behaviors. So actually creating a 20-minute neighborhood might be, it doesn't seem to have any effect, but actually if we focus on maybe reducing the health harming environments within a local area and increasing potentially health benefiting, that's probably going to have a better effect on public health and health inequalities. And then I was just thinking through how we might do that, because sometimes we have these grand approaches and you think, well, how could planners actually incorporate that? And we could tackle the co-location of health benefiting and health damaging environments. So, bold policy decisions about maybe restricting fast food outlets, the number, if there's already so many within a street, not allowing any more in that place, which is a quite bold policy recommendation. For children, thinking about actually, there are policies around getting the children to attend their closest primary school. Maybe that was enforced more rigorously. Then it might encourage less motorized trips to take the child to that school, and they might walk or cycle. And then access to quality local services are really important. And think about research about how we'd measure that quality is something that I think we need to think about, especially on a national level. I think on a local level, it's a lot easier to do. But then also understanding local population need and making sure the places are designed for that local population. And then there's also other local policies, which again are very popular, But if we think about that, actually, the amount of major roads, pollution that are in local places, there's potentially other local interventions that could provide greater population health benefit. So low traffic neighbourhoods, the very popular Welsh 20 miles an hour speed limit, which I think is being sort of scaled back now, which is a bit of a shame. But the low traffic neighbourhoods, there's been some great evidence from London that suggests that cutting off the through flow of traffic within local places has found actually a huge increase in the walking and cycling of the local resident, and also dispersal effect on the neighbouring streets where they've increased their walking and cycling and reduced their car use. So you can see that it's really having an effect. Then low emission zones, and also creating more maybe active travel corridors. So facilitating people to walk safely from place to place, and remove that car travel. So that was a sort of a whistle-stop tour of the 20-minute neighbourhood and local planning research we've been doing in Glasgow. And then just to thank the people who've worked with me on this research, and then open up to any questions.
Thanks, John. Really interesting. So yeah, I'll open up the floor. If there's anyone on Teams, then feel free to raise your hand or put some question on the chat. But I'll open up to the room first to get the privilege for you came to the seminar. So anyone in the room have a question for John? Jen.
I really enjoyed that. I'm just interested to know your thoughts and where rural communities are factor into that today, because I can see how it's in eminently urban communities.
Yeah.
I just don't see how it can work in more rural communities. But again, linked to that, your concept is really interesting, and I think has some on top of the trade standard tool, because you have to engage a lot of different community members to get a good representation of the concept. But with your mapping, were you just using the centroid for your analysis? So how representative then of rural communities where you often have really large
Yeah. So in terms of the postcodes, they weren't the centroids, but they were weighted towards where the buildings were. But they still, for rural areas, yeah, they're heavily skewed. And how it clips to the nearest road based on a road and network analysis, would have biased the results and is a limitation. I think in terms of the rural communities, I think the research shows that 20-minute neighbourhoods aren't right. And there was a great report. It was by a consultant for the Scottish Government, and he actually went to a lot of rural communities and did workshops with them. And each community wanted different things. So there was a community that wanted an e-bike scheme so they could travel. And I know the hub and spoke model works a lot for rural communities where they don't actually want everything locally. They're happy to have a central hub, maybe in one area where they can do everything, and they're willing to travel there, rather than, a patchy facilities across different places. But if they are centralized in a hub. But I think, again, for rural communities, it probably needs to be based on local population need. But one of the worries, and speaking to some planners, one of the worries about the local place plans, which is, I think the Scottish Government's way of saying to any community is, you come with your ideas and this is how we're going to engage with you, is just that we constantly get the same voices of the, I live in a small village which has a community trust, and it's just the same voices that are heard. So I suppose it's making sure the true community voice is heard as well.
Any other questions? Yes.
I was wondering, I don't think you mentioned what was kind of being climate change ready? So, we see a lot of, I'm thinking globally now, right? Like, I'm thinking of, there's a 20 minutes neighborhood, maybe somewhere in Spain, and they maybe can't use it for 3 months in a year because it's just too hot and there's tarmac everywhere, or in Scotland, maybe some roads are constantly flooded. So are we climate change ready in this kind of 20 minutes neighborhoods, or did you look at this? Or
No, but I think that's an interesting point. And we've worked on a project about green space. So a lot of our research in our groups about green space as well, and thinking about how we measure quality green spaces. We work with a group in Australia, and they very much talk about greening of roads. So one way of maybe creating a walkable area in Australia is to make sure there's lots of tree canopy, so you're protected from the sun and you can walk safely, protectedly, cooler, and it'll also have urban cooling qualities as well. But I don't think I think looking at some of the policies that we reviewed, so we reviewed them and tried to extract what they said about health. But I think quite often 20-minute neighbourhood is just put in, and I don't think they've really thought through how you'd create a climate-ready 20-minute neighbourhood or a health benefiting 20-minute neighbourhood. So I think there's lots of opportunities to explore that.
Thank you. I'm trying to think of how to formulate a question. I don't mean it to come off as like lunch, but is it when you measure like the improvements of making the neighborhood more walkable, is it the same demographic that's there, or is it like gentrification where, you know, like people who can afford to live there that are reaping the benefits of the investment? Like, how do you kind of measure that?
Yeah, and that's so we've very much looked at it in a static approach. There are lots of avenues you could do. So you could see how places have formed. But that was one of the points that keeps coming up, is if we go in and improve a place, will we just gentrify it and move out potentially those people living in the most deprived areas? We improve the place, it's a lot better, the house prices go up, people from other areas want to move in. So I think that's something that needs to be considered about how, if we just go in and improve a place, that we don't just kick out the people who are trying to improve their health because more affluent people want to move in. So I think gentrification could be a disbenefit of creating this policy. Yeah.
Yeah, sorry, I'm an interloper from the management school, so slightly different question and well focused, because we're more interested in, or we've been interested in some of the inequalities in relation to food, so focusing on that bit. And I guess it's a comment, then a question. The comment really is that I find it quite interesting because the up until the late 80s, early 90s, in terms of food, British local authorities had a retail hierarchy which incorporated this sort of thing in it. And therefore, in some ways, it doesn't surprise me in somewhere like Glasgow that they were incredibly aggressive in making supermarkets open in some of the inner city areas. So if those are still there, that's one reason why they're there. Over the last 30 years, those controls have disappeared, and therefore the new stuff around it is not being treated the same way. So I think it's out with your study, but I think there's a big issue around it's easier for local authorities to affect speed and local their facility. Actually finding a way to get some of the commercial activity back in there is going to be quite tricky. But relating to that, I was just interested to know in terms of the methodology, the methodology if you repeated the study. You were saying that in terms of this idea of walking and therefore access, more deprived areas have got more supermarkets than the least deprived. Is it a win if we said, well, the least deprived don't need one because I can have Tesco deliver to my door in 20 minutes. I am walking, but my food is coming to me. Is that a win in this policy, or is that a disbenefit because we wanted local facility? I'm just trying to look at how we measure this sort of the way it's presented is this is bad, but actually, if I'm driving to the supermarket 40 minutes away, Again, I like what you said, it was good or bad access. Actually, as with the car, if I'm less well, I've actually got much better access. That's a different problem. But is it a win if stuff comes to me in smaller quantities and I walk rather than taking the car to places?
Yeah, and we answered it very much. We looked at it very much in terms of what the policy said and answering that question in terms of access. But I think that's a good question because actually, people potentially from the most least deprived areas have chosen to live. They don't want to live by a supermarket. They've chosen to live in suburbia or, sort of more rural areas. And actually, we also need to consider who wants to physically access things. We're changing a lot, and COVID changed what we did. So if we think about even access to primary healthcare, I'd prefer to just do an e-consultation if I had to see the doctor. So do we need physical access to all of those things that we've considered? I think that's a question, but then we also would need to think about which communities would most be disaffected by that. So potentially older people, those who have poor digital literacy. So if we think about access to online food shopping, do you have super fast broadband to your home? Rural communities might not. And will the supermarkets deliver there? So there's maybe little incentives that we need to improve. Broadband, maybe the government needs to support supermarket shopping. But yeah, we answered it in terms of what was said within the national planning framework about access, but I think there's key questions about, is that good or bad? Is a good question.
Thanks. Probably time for one more.
Thank you, very interesting. I was wondering if the data can say anything about what less deprived communities are accessing outside of their 20 minutes that might be presumably good for them.
Yeah.
Obviously they're avoiding air pollution and road accidents. But what is it that they're accessing
by traveling? Yeah, I think there's
that they're traveling for the children anyway.
From the least deprived area. Yeah, and we don't know. We tried to use the GPS study for the GPS data for a different study where we looked at recreational resources, and we were just thinking about how far children went, and we actually found that most children they didn't attend a most local sort of leisure centre. They travelled to another one, and it was pretty random. So you just don't know. Lots of parents, they drop the kid off, they work somewhere, or there might be a class at there, or their grandparent might live there. So I think this complexity around decision making is something that's really hard to measure on why people go to different places as opposed to another. But that's maybe where the qualitative research could come in.
It could just be a side effect of having parents that work somewhere.
Yeah, or the kids, they go with the kid's friend wants to go to the dance class because they're friends there. It just could be, yeah. That's one limitation with these sort of big quant studies, is you just don't get that richness of why.
Thanks. Well, yeah, I think we've badgered you enough with questions here, John. So yeah, so this leaves me to thank you for coming and thank John for his time. Thank you very much, John.